start when you are ready.
Okay, hello, my name is Arash Asher, and I am serving as the Director of Cancer Rehabilitation and Survivorship at Cedars-Sinai Cancer. So by way of background, after I finished medical school, I knew I wanted to work with oncology patients, but after a while, I realized it wasn't that I was so deeply interested in coming up with their chemotherapy regimens or radiation therapy plans or whatnot. I was really interested in helping people get through the experience and recover and integrate back into their roles and both physically, functionally, emotionally, socially, etc. And so I ended up doing a residency in physical medicine and rehabilitation. And at that time, there were still some in the rehab world that viewed oncology rehab as a bit of an oxymoron. This was around, 2003, 4 when I started residency. But just as I was finishing my residency, the first formal cancer rehab fellowship started at MD Anderson in Houston, Texas. So I think, it was, some way providence on my part to have that open up just as I was finishing. So I became the first fellow at MD Anderson. It was a perfect fit for what I was looking for. And after I finished my fellowship, I started here at Cedars-Sinai, where we really, I think, as a team, put a lot of attention to the issues that may have been, to some degree neglected, because the focus was, of course, importantly, focused on survival and getting the best oncologic treatment. So our practice is now consisting of helping people through the aftermath, all the things we know about cancer-related fatigue, chemo-induced neuropathy, post-mastectomy pain syndrome, chemo brain issues, exercise prescriptions. I mean, I can go on and on and on, but I think the idea, in fact, that today there are now several cancer rehabilitation fellowships around the country has put the spotlight on the fact that this is a distinct area of need, and I'm excited that it's gotten increased recognition among our oncology colleagues around the country, and I think the field is destined to grow as we become a more coherent field. So I hope that this series that we're about to embark upon with OncoDaily will put some attention on the important issues that cancer survivors and patients may face. I would like to draw attention to some of the work that we've done within our cancer rehab and survivorship team, some of the studies that we're opening up soon or planning on opening up soon. I'd love to talk about some of the programs that we developed here to combat cancer-related cognitive impairment, cancer fatigue, some of the existential and spiritual issues that we know our patients go through when they're facing, for example, fear of recurrence or fear of mortality or all the unknowns that come in this space. I think it's worth exploring some emerging therapies, for example, for chemo-induced peripheral neuropathy and some of the pain syndromes that we're seeing, such as, we see a lot of breast cancer survivors, such as aromatase inhibitor associated arthralgias and the like. So I hope this puts some more attention on, I think, an important arena, which is cancer rehabilitation and survivorship, because I think our colleagues in this space have a lot to offer, and I appreciate the opportunity.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.